Hello and welcome to our program. I'm Lana Kay, and we have an extremely important show planned for you today. So important that it just may save your life or a loved one's life. Let's welcome our guest, Joyce Jacobs, to the show. Welcome, Joyce.
Thank you.
It's good to have you with us. Now, Joyce is with St. Elizabeth Healthcare. She is a prevention and wellness nurse navigator, Heart and Vascular Institute. She's a registered nurse and also an MSM. So I think she has some pretty impressive credentials. Joyce is going to talk to us today about heart attack and stroke, our symptoms, and maybe we'll have time to go into some prevention, which is very important. But for now, we know we're going to do symptoms, and we're going to start with heart attack. First of all, Joyce, before we begin, let's talk about St. Elizabeth Navigators.
Okay. So as a navigator, I'm a community nurse educator. So I'm out in the community teaching classes every day, everywhere in the community.
So this is very important because you're getting the word out.
Correct. And having the community educated is very important.
And today we hope we'll take that another step forward, Joyce. So let's start with our heart attack. Would you like to start there?
Sure, I'd be glad to. So heart disease is the #1 killer of men and women. 6 times as many women die of heart disease as breast cancer, which is kind of scary. We do a really good job of screening for breast cancer, but as women, we don't do as good a job to take care of our heart. So it's very, very important to know the signs and symptoms of a heart attack. We used to think of symptoms of a heart attack as crushing chest pain, pain in the left arm, pain in the neck. But that's not necessarily true. Over the years, we've found that that is not true. You can have the chest pain, you can have the pain in the left arm, but you can actually have pain in either arm, not just the left arm. You can have pain just in your neck. You can have pain just in your jaw. One lady thought she had a toothache, went to the dentist checked her teeth were fine. Sent her to the emergency room, they checked and she was having a heart attack. She never had chest pain. Especially with women, their symptoms can be different. Women can have pain in the epigastric area, which is the upper abdomen, the upper portion of your stomach. You can have pain between your shoulder blades. You can have shortness of breath. You can have nausea. You don't have to have all the symptoms at once. One lady that I know was on vacation walking on the beach, and she said every day walking with her husband she would get short of breath, and she said, you know, when I get home I need to start working out more, just thinking she was out of shape. So when she came home, she had an appointment with her doctor, went to the doctor and mentioned to him that she was short of breath when she was walking, and they did heart test on her, and she ended up having to have bypass surgery.
Wow.
Never once did she have chest pain. So it's very, very important to recognize the symptoms. Women can also have unusual fatigue, just like flu-like symptoms. So, you know, if we lined up 20 people that had had a heart attack, we wouldn't have the same symptoms with all 20 people. And that's what's important to recognize, that the symptoms aren't the same. So with a woman, these are some of the symptoms. You can have the chest discomfort, you can have the nausea, you can have the sweating, but you don't have to have all the symptoms. The most important thing is recognizing the symptoms, recognizing
even
that
one of those.
Something is unusual, and it doesn't have to be an older person. They're finding that younger women are having heart attacks. So it's important to recognize it. Women are less likely than men to go get their symptoms checked. And the reason is because as women, we are too busy taking care of everybody. Think of everything that you have on your plate. You think you're the healthy one in your family. So why? That's not me. That's going to be somebody else that has that heart attack. Or somebody older. Yes, somebody older. So that's why it's important to recognize the symptoms.
Absolutely.
And call 911. It's very important that if you have symptoms of a heart attack, Don't drive yourself. Don't call your doctor. Don't have somebody else drive you. Get to the emergency room right away. If you think about it, the heart is a muscle, and that heart is not getting blood. So it's like if somebody put a tourniquet around your wrist, and that tourniquet just kept getting tighter and tighter and tighter, you would lose circulation and your hand would die. So that's what's happening to your heart. So it's so important to get to the emergency room and get that artery open back up, to get that blood flowing back to that area of the heart.
Oh, absolutely.
So you don't have the damage that you could have.
The sooner the better. Okay, now let's talk a little bit quickly. We've got time, I think, Joyce, to do all this. So tell us, what can we do? And this lady must have been in fairly good shape that you exampled, but what can we do to prevent as much as possible?
So some things that you can do, the American Heart Association it's called 7 Simple Steps to help prevent heart disease. And the first one is don't smoke, and if you do smoke, then quit. Have a healthy weight and exercise regularly. American Heart says 150 minutes weekly, which is 30 minutes 5 times a week. And you don't have to do those 30 minutes all at once. You can break those down.
And can it be just being out, gardening, clipping, bending up, down? You know, I wonder sometimes, it doesn't necessarily have to be this oof, 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 oof.
You do not have to join a gym. You can work out in your yard.
Yes.
You know, you can get very strenuous exercise in your yard.
Yes, you can.
But you're moving and you're getting your heart rate up, and that's what you want to do.
That's what we want to do.
You also want to not only do those things, but you want to eat lots of fruits and vegetables. At least 5 fruits and vegetables a day. And if you think about it, if you're eating those, you're less likely to eat the bad stuff.
True.
You know, if you're filling up on fruits and vegetables, you're not likely to eat the potato chips and candy. Know your cholesterol. Know what your numbers are. And, you know, try to keep those under control. Keep your blood pressure under control. Have your blood pressure checked regularly. Blood pressure machines at home are great. Write down your numbers. Take that with you to the doctor so the doctor can see what your blood pressure is. Also, if you have a home machine, every once in a while, take it with you to the doctor's office so they can check it with their machine and with your machine.
Your machine is working properly. Yes, great idea.
Because those machines can't be calibrated, so that way you can see, okay, my machine is about the same as what the office is.
Right.
Also, blood sugar. Make sure your blood sugar is under control. We have so many diabetics in the country today. Make sure that your blood sugar is controlled. And those are very important things.
Very great steps, Joyce. Well, let's move on to stroke. And this can come out of the blue.
This can come out of the blue. So stroke, if you think of BEFAST, B-E-F-A-S-T.
BEFAST.
BEFAST. Those are that's how you can remember the symptoms of a stroke.
Okay.
Start with B. B is balance. So all of a sudden the person has a loss of balance. If they're sitting, they may fall over, or standing, they may need to hold on to the wall.
Okay.
E stands for eyes or vision.
Okay.
All of a sudden there's a loss of vision, usually in one side. It could be that it's like a screen is suddenly pulled down over one eye. So that can be a symptom. And then F. F stands for face. Face. So you would have drooping of one side of your face. So if you ask the person to smile, the affected side would not go up.
Okay, a paralysis.
Paralysis.
Okay.
Yes. The A would be arm or arm and leg. So it could be that the person couldn't move their arm or leg at all, or they just have weakness, tingling, or they go to pick up something and they can't grasp it.
Okay. Oh, that's great.
And S stands for speech. Speech can be slurred, it can be very garbled, or it can be that they can't speak at all.
Oh, wow.
And the T stands for time. It's very important to get to the emergency room because if the stroke is caused from a blood clot, they can give you medicine to dissolve that. But there's a time frame, a 3-hour window that you need to get there. So let me go back to speech a little bit. I've had people in my classes that have had a stroke, and it's kind of divided on whether or not the people can recognize that their speech is slurred. I've had people that have had a stroke that said, I could tell my speech was garbled. Things didn't come out right. And then I've had people that said, I was saying my name, and in my mind it was perfectly clear, but the person asking me my name kept saying, honey, what's your name? Honey, what's your name? And it was so frustrating because I was
They
saying
felt
it.
they were clear.
So if you're with somebody and you suspect that they're having a stroke and their speech is garbled, just remember in their mind it may be normal.
True, good.
So
good point.
you
Great
know that's
point. It can happen.
It can happen, and with the stroke, you have the clot and you have the damage. A TIA is a mini stroke, and you can have multiple mini strokes, and that stands for trans-ischemic attacks. So you have the symptoms of a stroke, but those symptoms can go away. So you could have the numbness, you could have the weakness of your arm or leg in the slurred speech.
But they pass.
But they pass.
So now do we still want to address
Yes.
that, though? We don't want to
Yes.
just say, well, I feel okay
Yes.
now.
Yes,
Something
you go
happened.
to the hospital
Okay.
and find out what happened. They can run tests to see because
Excellent.
you don't know, and if there's a blood clot, they can give you the medicine and dissolve that. They have done so much with stroke over the years. You know, when I was young, whatever happened when somebody had a stroke, that was it.
That's
but
true.
now, you know, they have speech therapy, they have physical therapy, occupational therapy, medicines to dissolve clots. And
I bet you've seen people come back from a terrible situation.
Yes.
It left them,
Yes.
and then they were able to rehab back.
Yes. And so it's amazing what they can do with stroke patients
so
now.
good.
It's very, very good.
Now, is there any way, do we use the same things to prevent heart attack as stroke?
Yes.
We're going to use our same
Yes.
tips that you gave us.
The same tips. Also, know your family history. Family
Very
history is very, very important. Know your family history.
I
Did
see.
anybody have a heart attack? Did
True.
anybody have a stroke? Did anybody die an early
Oh.
death? And those are things that not only you need to know, but pass on to your children also.
Oh, that's excellent, because
Yes.
they need to know what's happened in our
Yes.
family. It could skip a generation and they could be involved
Yes.
instead of us, or, you know, it could be
Right.
us and them and the previous. So, very good tip, Joyce.
And know that high blood pressure, high cholesterol, and diabetes are best friends with heart disease. So if you have those, it's going to increase your risk of heart disease. So that's why it's important to keep those maintained and keep those within normal.
Keep those numbers within normal.
Yes.
No matter what, take your blood pressure medicine, take your cholesterol medicine.
Yes.
And just as long as we're doing everything we can, everything should roll along.
Yes.
Great.
Yes.
Okay, now, I noticed on your resume that you are also a certified tobacco treatment specialist.
Yes.
And I am very impressed with that, because many years ago, and I know it's not in vogue now, but it was then, and all my girlfriends smoked and I smoked, and of course I've quit, and it's been many, many years, but it was tough, Joyce. Maybe the hardest thing I ever did. So tell us, what tips can you give us outside of coming in to be treated with you? What tips can we try to overcome that?
And you're right, it is very hard. I have people in my classes to help people quit smoking, and some of them have been on heroin, and they tell me it was easier to quit heroin than it is nicotine. It is so addicting to the brain. And you know, if you want to quit smoking, think of why you want to quit smoking. You know, what is your reason? And it shouldn't be that my wife wants me to quit or my doctor wants me to quit. It should be something personal for you. And you know, maybe I've had people that are quitting because of their grandchildren, and they actually take a picture of their grandchildren and put it on their pack of cigarettes. And every time they pull out that pack of cigarettes, they see the reason why they want to quit. Or they put that picture where their ashtray is, so they see the reason for quitting.
Joyce, now we're getting the commercials. And of course, I know you've seen them. the lady with, is it a stoma here, that she has her machine, and another lady is, you know, I use the nicotine patch and the gum and I quit, and she says, before this happens to you. And I mean, those, now listen, those get your attention, am I right?
They do get your attention.
But do you think they sort of check in with that addictive brain, and you still want it to be more personal?
You want it to be personal because that happens to somebody else. That doesn't happen to me.
Oh, that is so right. This can't happen to me.
Yes. You know, the heart disease, the heart attack, the lung cancer, that all happens to other people.
That's
it doesn't
true.
happen to me. And Kentucky has more lung cancer than any other state.
Is that right?
Yes.
That is an
Yes.
alarming statistic. I
Yes.
did not know that.
Yes, because we have so many smokers. So,
Gosh.
you know, it's very scary. And I feel like if I can help one person quit smoking, then I have accomplished something. I grew up, my dad was a smoker. He quit when he was 68. And
68.
And then 10 years later had lung cancer. So this is a passion of mine, you know,
of course.
helping people quit smoking.
That's personal. It became personal
Very
for you.
personal.
Yes. Well, it was the best thing I ever did. It may have been the hardest thing I ever did, but, you know, I cried over them, Joyce, and I was a true addict. I mean, I had bronchitis, recurring bronchitis, 104-degree temperature, and I'd still light up. That's an addict. So it was very difficult for me, but I'm so glad I did that, and it's been almost 30 years.
Well, that's great. Over a year ago, Kentucky passed a law that the major health insurances and Medicaid will now pay for any FDA-approved medication to help people quit smoking. And that's things like patches, gum, lozenge, even over-the-counter products. And if they will pay for one product, such as patches, they'll pay for gum or lozenges with that. So it's very important to talk to your doctor and you know, see what the doctor recommends for you to help quit smoking, and then get a prescription to help.
Very good. Joyce, you have been an amazing guest, and we're almost out of time. And is there any information you'd like to leave us with, any thought that you have for our audience?
Well, one thing I want to touch on is vaping and juuling. That is such a hot topic now. I go to the schools and educate parents, I educate students, and the FDA, CDC is recommending if you don't juul and if you don't vape, don't start. That's the big thing. Get off of it. It is not an approved method to get people to stop smoking.
That is so great. Great information, Joyce. Thank you
again. Thank you.
Hey, you've been listening to Joyce Jacobs, Prevention and Wellness Nurse Navigator, St. Elizabeth Healthcare. She's located at 4900 Houston Road, Florence, in the complex right across from Walmart. Joyce has given us life-saving tips today, and I think the most important, I believe, is act quickly. As the old adage goes, better safe than sorry. And I've enjoyed her. I've learned so much today. I know you have too. Until next time, you be happy and keep smiling, and I'll see you soon.